There is an increasing interest in cognitive impairment in survivors. First of all, because the time of survival is prolonging a lot, and also in elderly patients. And in fact, my topic was particularly in elderly patients. Unfortunately, this type of the symptoms related to cognitive impairment are not regularly assessed in clinical practice, as is regularly assessed pain, for example, fatigue, anxiety, depression. And this is one of the problems because these kind of symptoms are underestimated in general in cancer patients, and in particularly in elderly cancer patients. Most of patients may have cognitive impairment during anti-cancer treatment, chemotherapy, hormone therapy, but also patients at the moment of diagnosis without previous anti-cancer treatments may have cognitive impairment. So this is a particular important topic now and for the next future, because we expected that the increased survival will be very high in the next future. The cognitive impairment are detected by clinical evaluation, first of all, and listening to the patients and speaking with the patients about the possibility to develop this kind of symptoms during treatment. Then we have some instruments like mini mental state examination that are not conclusive to do a diagnosis, because some patients had to be admitted to a neuropsychological test, a battery of neuropsychological tests to have a good assessment of the cognitive impairment, and also to monitor this quantity and this type of cognitive impairment during the trajectory of cancer treatment. We hope that in the next future there is a change in the attitude of oncologists and also of the primary care physician regarding the assessment of these symptoms, the evaluation of these symptoms, and also the consideration of aging as a possible risk factor and the frailty of the patients as another possible risk factor for a worsening of the cognitive impairments. They have to recognize and assess ask to the patients and also to the relatives and to the caregivers what is happening regarding the memory, for example, regarding the concentration. In the same way we assess pain, fatigue, we assess sleeping disorder, we have also to assess this kind of problem, cognitive symptoms. And then we have to tailor the pharmacological treatment, the oncological treatment according to this kind of problems. And so we can't be very aggressive with many therapies when the patients have this kind of problem, cognitive impairments, or also in the survival. We have to recognize that some kind of cognitive impairments can be recognized 10 to 20 years after the end of treatment. And so the survivorship is very important and is a new model of follow-up of the patients in oncological setting. I believe that the future is the oncogeriatrics, because we need absolutely in the oncological setting the presence of a geriatrician with training in oncology to better assess the patients before treatment, but also before surgery, and also at the moment of diagnosis, the distress that this kind of communication can provoke in patients, and then to continue monitoring the patients during treatment and during survivorship. First of all, they have to speak to the patients and speak regarding the possibility of a toxic effect on cognition of the anti-cancer treatment. In general, we speak of the possibility to have nausea and vomiting, to have fatigue, to have constipation or diarrhea related to the symptoms, but we don't speak to the patients about the possibility to have cognitive impairments. And so first of all, speak to the patients and to the family and the caregivers about this possible toxic effect of treatments. Then evaluate it over the time, because it's not easy to treat it. Really, we don't have sure treatments. In particular, we have no evidence at all regarding the pharmacological treatments of this cognitive impairment. We have exercise, even there is no great evidence, but we know that exercise works very, very well with all kinds of patients. We have rehabilitation programs to increase memory, to increase cognitive exercises, and there are now some new programs like inside programs, recent programs that have shown to be better, much better in respect to standard of care, and it's possible to treat also this patient by a website, and not only in the hospital but also at home.